Hi, I'm Wendy, and this is POPPYN, which stands for Presenting Our Perspective on Philly Youth News. We're a youth-led news show that highlights the positive things that youth are doing in the city and issues from a youth perspective. In today's segment, we will be covering the topic of reproductive justice. Reproductive justice is the right to bodily autonomy. Let's break that down. Bodily autonomy is my right to decide what gets to happen to my body. Bodily autonomy is also your right to decide what gets to happen to your body. Sounds fair, right? Well, recent U.S. policies beg to differ. Let's begin with the simple fact that Title X, the only government-funded program when it comes to family planning, is under attack. As of May 3, 2019, the gag rule, initiated by the Trump administration, prevents abortion as a viable option by ensuring doctors do not disclose all information to their patient. As decided on June 20, 2019, an additional effect of the gag rule is the potential $60 million cut from programs like Planned Parenthood for providing referrals for abortions. This will ultimately affect up to 4 million Title X patients, many of which are people of color. All hope is not lost, though. We speak to members of New Voices for Reproductive Justice to explain the challenges that women, girls, and femfolk face when it comes to their bodily autonomy.
New Voices is a human rights and social justice organization in partnership with LGBTQ organizations to achieve the full health and well-being of Black and brown working class folks, specifically investing in the leadership of Black women, femmes, and girls.
Reproductive justice is important to me because as a Black girl in society, I feel that there's a lot of limitations for people of color and for women, and I want to make strides to change that.
What are these limitations that our youth, Jalen, bring up? Makaih speaks on one such limitation: judicial bypass.
Judicial bypass is the process by which folks under the age of 18 access abortions that do not want to get their parent or guardian involved. First, the young person has to go to the clinic to get information around their reproductive options. Then they have to go see a lawyer to file a petition, after which they have to go to court to actually have that hearing around why you want to get a judicial bypass, just to determine that you have the capacity to make this decision, and then after which a young person can finally access an abortion. Judicial bypass has been around for over 20 years now, but it's definitely not the only policy that is limiting abortion access. It's a part of this pattern that has been ongoing since we first obtained the quote-unquote right to have an abortion since Roe v. Wade, but that's only one of a few ways in which abortion is limited.
A lot of the times people think that reproductive justice is just about abortion access. But reproductive justice is being able to own and encompass the fact that it is so intersectional and non-binary, that it touches on all of our experiences and allow us to be our whole self within all of the dimensions. So I recognize that I have decisions and not choices to make.
Well, what are youth doing about these ongoing issues? Jalen provides for us some personal insight.
So I've been doing research about fake clinics, also known as CPCs, crisis pregnancy centers, and they're basically places where they pose as abortion centers, thinking that they can give you a bunch of information about abortions and pregnancy, yet the real purpose of these places are to encourage young women to not go through with an abortion.
For me, the main ways that you can support reproductive justice is being clear about the points and the values of reproductive justice, to know that reproductive justice is different from reproductive health and rights, knowing that reproductive justice is a movement steeped in multidimensional Blackness beautifully, and knowing that reproductive justice is about achieving our full health and well-being within our healthcare and how we see our healthcare.
I see the future for reproductive justice being that everyone will have the same opportunity, no matter our sexual orientation or color of their skin. I feel that everyone should be treated equally and have the same care, in a sense, for healthcare and other opportunities.
I'm clear that I am nothing without my community. And so I do my study and my work knowing that one day this will help my community. It may not be right now, but it will be soon.
Thanks so much to Chris, Makaih, and Jalen for speaking to us in this segment. We hope you enjoyed this segment. If you'd like to see more of our work, you can find us on all platforms at What's Poppin'. Once again, I'm Wendy, and that's What's Poppin'.